In this video, I'm going to show you how to stop tinnitus in 30 seconds. Stay tuned. Hey everyone, Dr. Rowe coming to you from Spine Care in St. Joseph, Michigan. This is going to be a two-part video that can give both quick and long-lasting tinnitus relief, or that annoying ringing sound in your ear. In the first part, we're going to focus on easy exercises that can give quick tinnitus relief even within 30 seconds. In the second part, I'm going to show daily exercises that are meant to give long-lasting relief or even possibly prevent that ringing in your ears. To get the best results, go through all parts and exercises and use what gives you the most relief. So with that being said, let's get started. In the first part, we're going to go over exercises that can give instant tinnitus relief. This first one is called the earlobe hook and pull. I treat this one like a self-adjustment of the ear or a self-reset that quickly takes pressure off the ear and may lead to a satisfying self-pop. When it comes to tinnitus, a big cause is from a buildup of congestion and pressure in the ear that affects the inner ear canal. So think a sinus infection or doing an activity that builds pressure, like after a flight. This one is very straightforward. You're going to take two fingers and make a clamp. I like to use my thumb and my index finger. And you're going to clamp on the earlobe of the affected side. If you have piercings, I would recommend taking them out. If you're unable to, work around them. Definitely don't irritate those. So you're just going to gently clamp on your earlobe right here. And the first movement, we're going to pull off to the side right here until we feel an initial tension right at the bottom of the earlobe. This one, we're going to pull and then quickly go up like this. So a nice fluid motion that kind of looks like this. It's all about speed with this, not about force. You can definitely use a little bit of force. Your earlobe is not going to fall off, but concentrate on quickly going up like this. I try to do this for about 5 to 10 repetitions, and then afterwards, see how your ear feels. If it feels like there's less ringing in there, continually do this one until you feel like there's no more improvement. But this may take several sets until you notice a reduction in your tinnitus, so keep at it. But this is a great exercise that you can do throughout the day to get quick relief, but it's also something that you can do on a daily basis to not only get relief, but also help prevent it. This next exercise is called the finger tapping method, and this one has gotten great feedback. It works by stimulating the 8th cranial nerve, the nerve that sends signals from our ears to our brain. You can imagine if that signal gets disrupted, it can cause a lot of issues, including ringing in your ears. I think the hardest part about this exercise is just the basic finger roll movement. So I want to go over that briefly. What we're going to do is take our middle fingers and then put our index fingers over it and then do a slight rolling motion downward to flick the back of our head. So it looks just like this. To get into position, we're going to take our palms and press gently into our ears to create a suction. From there, we're going to trace straight back. If you feel right on the back of your head, you'll feel a ridge. That's where we want to put our middle fingers. That is the occiput. From there, we're going to then take our index fingers and put them over our middle fingers and then do that quick flicking motion, that tapping motion downward on the back of your head. Only apply enough pressure in there where you're going to feel it, but it's not causing any discomfort. You want to do this over and over again for 20 complete repetitions. Afterwards, see how you feel. For a lot of people, this will give instant results even within 30 seconds. But if you don't get an improvement in your tinnitus right away, don't be discouraged. A lot of times it will take upwards to 5 to 10 complete sets before you notice a reduction in that ringing. So keep doing this over and over again. And after each set, notice how you feel. And you want to do this until there's no more improvement or until that tinnitus has pretty much gone away. The great part about this exercise is you can do it throughout the day, anytime that you need quick tinnitus relief, but you can also do it daily to help prevent it. In the second part, we're going to focus on exercises that you can do daily for long-lasting tinnitus relief. These are going to target a buildup of stress, tension, and tightness in the soft tissues around the jaw, especially with TMJ, the ear, and the neck. As this tension builds throughout the day, you can get a lot of pressure being built in the ear, including that inner ear canal, that can lead to ringing or tinnitus. So these are meant to be done throughout the day just to help release that tension and hopefully get long-lasting relief. What I'm going to do is target a muscle to begin with called the temporalis, which is a thin fan-shaped muscle that goes across the side of the head right here. It's also a big hot spot for tension headaches and TMJ issues because it's a muscle of mastication, chewing at that point. So what we want to do to start off with is take 2 fingers and go right to our temple. That's that little bit of a divot right here at the corner of our eye socket. Just take 2 fingers and do a light massage in there. Apply enough pressure where it's going to feel comfortable. And I'd like to do this one for about 15 to 20 seconds. And you can do this one for a couple of times if you feel like you're getting some more relief. From there, we're going to focus on the temporalis. So this time around, I'm going to take my 4 fingers, the back side right here, and press into our temples, and then just kind of rake backwards across the side of my head. When we do this, we want to start with a closed hand, and then as we go back, we're going to open it up just like this and kind of rake into that muscle. I like to do this one for about 5 to 10 times, just nice and slowly. And with each repetition, try to build a little bit more pressure in there. From there, you can take this one to the next level by attacking those muscle fibers at different angles. So instead of going straight back, go at a different angle, like 35, 45 degrees, something like that, and repeat. You may find that it offers more relief. Afterwards, I'm then going to target a little bit more around the ear and the jaw right here. So open and close your mouth a couple times. What you want to do is locate that area where the jaw meets the corner of your ear right here, and then take 2 fingers and do a gentle massage in there while closing and opening your mouth. And do that roughly for about 15 to 20 seconds and throw in a couple sets until you feel like all tightness has pretty much released. So after we have the muscles and soft tissues around the ear and the jaw all loosened up, we're now going to turn our attention towards the neck. I'm going to start with a muscle that runs on the front of the neck called the SCM, or sternocleidomastoid. This one is highly associated with jaw issues that can lead to pressure in the ear, especially the inner ear canal. So what I'm going to do is start off by looking over one shoulder as much as I can. Doesn't matter what side, we're going to do it on both. Turn to look over one shoulder as much as you can, and when you can't go any further, then you're going to tilt your head backward into extension. This will cause a deep stretch on the other side of the neck. So if you're turning towards your left, you should really feel a deep stretch into that right SCM. You want to hold this one comfortably for 20 to 30 seconds, but if it feels good, hold it for longer. You can hold it upwards towards a minute if you would like. But you want to relax and then repeat this one 3 to 5 times. And with each repetition, try to build into it just a little bit more. If you want to take this one to the next level and get a deeper stretch, do this. Get back into that original stretch, but take your palm right here and press down on your collarbone. So if you're looking towards your left, press down on your right collarbone. This will really intensify that stretch, so only go towards your comfort level. Afterwards, switch to the other side and repeat to keep everything in balance. Next, let's move on to some muscles on the back side of our neck. The first are going to be the suboccipitals right here at the base of the skull. This is a hot spot for tension that can cause headaches and also causes people to get a lot of stress clenching down on their teeth, leading to jaw issues and ear issues. So for this one, what we're going to do is have very good neutral posture in our neck. Take 2 fingers, put it right on your chin right here, and press your head backward into a head retraction. You should start to feel the muscles in the neck start to fire. So let's hold this position, and then what I'm going to do is take my hand, put it on the back of my head, and gently hook and pull my chin downward towards my chest. As you do this, you're really going to feel a deep stretch forming on the base of the neck. Really focus on feeling it there. Again, 20 to 30 second hold, you're going to relax, and then repeat this one 3 to 5 times. The last muscle that we're going to focus on is called the levator scapula. It runs from the top of the shoulder blade and goes up to the side of the neck towards the back of the ear. It has a trigger point pain pattern pattern that causes a lot of pain around the ear, and it can also affect the inner ear canal with that pressure buildup. So it's really important that we obviously take that pressure out. This one is known as the armpit sniffer, and you're going to see here why in just a second. So with this one, I'm going to again turn my head to look over one shoulder as much as I can. When I can't go any further, I'm then going to take my chin downward and tuck it towards my armpit. You should feel a deep stretch forming on the side of the neck right here going towards the ear. To intensify this, we're going to take our hand, hook the back of our head, and now passively pull our chin downward towards our armpit until we feel a really deep stretch forming. We want to hold this one for 20 to 30 seconds. You can hold it for longer. You're going to relax. On the next repetition, try to build into it just a little bit more. 3 to 5 repetitions, and then you're going to switch to the other side and repeat to keep everything in balance. If the exercises helped, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.